It is with great pleasure that we are here again partnering with Kenya Red Cross Society on the prevention of COVID-19 pandemic that has persisted in the country for the last 6 months. Although the number of infections in the country appear to be subsiding, let us not celebrate, as the disease has shown a trend of resurgence globally. Classical cases being that of South Korea, Italy, Japan, and Spain. We can only succeed in the eradication of COVID-19 infection through strict compliance with the Ministry of Health regulations on social distancing, wearing face masks, and washing hands with soap or sanitizer. We sincerely thank the national government, our health partners, and more particularly Kenya Red Cross, who have stood with us in the capacity building of frontline service providers and first responders, supporting prevention activities in the community, prison facilities through sustained health education and provision of supplies such as hand washing stations and face masks. Our county experienced a total of had a total of 1,399 samples that have been tested for COVID-19, and out of this total we have registered 36 positive cases with one unfortunate fatality. The 35 infected individuals have since recovered. 29 at the isolation wards, and the other 6 who are health staff were managed under the home-based care. I therefore thank the frontline health staff for the effective management of the said patients. My message to the health workers and all our partners is that they have done a good job. They have actually fought this disease head on, and we really appreciate their effort. You know, when we are appreciating the effort, we should know that also they are at risk, especially the frontline staff. You have had about 5 of our staff have been infected. Thank God now they are all okay, all of them. And that means they are taking risks. So we would like to inform all the other health workers that they should not be scared. You know, these risks are there, and in fact the government is giving them what is called risk allowance, isn't it? Yeah. Risk allowance is there. So they were trained, the staff have been actually adequately trained to fight any disease, not only COVID, but any other disease. So we really thank them, and let them continue doing the good job. Let us continue. People should go and volunteer to have them tested. So the more we test, the more we will know that people in Wajir have actually responded to our call.
Today we converge here to witness the official handover of COVID-19 supplies from Kenya Red Cross, and I want to take this opportunity to thank Kenya Red Cross for the compassionate support. We are all aware PPEs are the new normal. Actually, it's a basic necessity. and anyone who gives you basic PPE at this critical time is your friend. I'm sure these donations will go a long way in complementing what the department has put towards the COVID-19 response. I want to take this opportunity to thank Kenya Red Cross, and we'll continue partnering in so many other areas.
Kenya Red Cross was today donating assorted PPEs to the county government of Wajir. We will first wish to acknowledge and thank our donor, UNFPA and the EU, for the kind support that they have offered to Kenya Red Cross. We have, the Wajir has registered 36 positive cases with one fatality, and generally, as an auxiliary arm of the government, it's our duty and responsibility to complement the efforts of both the national government and the county government in enhancing the fight against COVID-19, which is an ideal. One challenge that we have currently with the pastoral community, which is common with the pastoral communities, is issues to do with behavioral change, issues to do with attitude. They still believe that, COVID-19 is not there, but through our own efforts and that of our partners, we are sensitizing the communities through public address systems, through the local FM stations on the dangers of this pandemic.